What we'll also do now is palpate the lumbar spine. Yeah, so, because what I want to try and do, we'll just keep the arms just on the belly for now, okay? Just going to put the hand under the lumbar spine. So what we're trying to do, it's a couple of things here. We're trying to look at the engagement of the erector spinae. So first we're going to go on this side and we're going to do the leg lift, yeah, straight and tight, to see how much engagement there is with the muscles and whether they're actually able to fix my hand down. And if they can't at any level between sort of upper lumbar and lower lumbar, those are areas which are not as functional. Now, it could be spinal. If we just go, that's great, okay, so we can see where there's a limit of tension being created because you can't recruit, perhaps because of training habits, those muscles, or sitting habits, or bad posture. So if we just get the fingers just into the spinal area, we actually palpate the spinal function doing exactly the same. Okay, and we can start to see where, if you like, the ripple effect is even and flowing between the lumbosacral joint and above.
At what point do you expect to feel it?
Well, it should be even 1, 2, 3, 4, 5, or 5, 4, 3, 2, 1, in fact, yeah? And if it isn't, then that's an area that we know is not very happy and not very functional. It may correlate to what you've seen standing up, and it probably should, but it may not, okay? What we then add in, apart from the other side, which we'll come on to, is we're going to use the arm position, okay? Because thinking of the postural compromises we saw in the standing images, if you put your arms up above your head, so if you were particularly kyphosed, as in curved, yeah, we'd probably want to lift the arms slightly higher, yeah, to reduce that curvature in a recumbent position, and then we'd do exactly the same. Now you're going to extend, you are extending your lumbar spine more, but with that tension created up here, let's just see now whether you can actually work that better. And actually it is much harder because you're so stiff in your upper body. Absolutely. Okay, so what we're going to do now to help that is actually to use your breath, which we haven't done yet. Yeah, and actually we're going to use an expiration, yeah, to flatten and use your diaphragm to actually push that upper lumbar spine down.
So exhale on the
exhale through the entire up movement. Yeah, so starting at the beginning and breathing in first, and then breathing out with that lift. Okay, so pressing down with the lift. Pressing down, pressing down, pressing down, pressing down, pressing down. So that engages the lumbar spine and it engages a lot more muscles, yeah, and down, okay? Yeah, and actually just straighten your elbows out because they're just bent, just straighten. That's really lock them out, yeah, okay? And so that's a way.
Why does that have an effect?
Right, so you're actually recruiting more muscles and the crura of the diaphragm. So you're actually getting the L1-2 working differently, okay? So engaging that differently will get the whole lumbar spine working stronger. And you can feel it. I mean, palpating that, and you could, I think, feel that as well, Charlie. Yeah. So you can feel that straight away. You actually feel the difference in the recruitment, okay? Now, if you go a little closer with the arms, yeah, and push a bit longer, just so we're slightly more engaged. And again, let me just come into here. And same breathing out as you lift, yeah? So down. And lifting up, there you go. Pressing the back down a little bit, just as you do. Yeah, and that's an even stronger engagement as well, okay? And just let it go. Great, okay. So there's some use of information there, especially if you're rehabbing someone in some detail. It doesn't rely on pain, it relies completely on function and actually palpation.